Okay, so we are going to discuss subdural hematoma, an 80-year-old woman who fell down during her household activities. She had a history of coronary artery disease and on a pen and a clopidogrel. On examination, she opens her eyes to pain, makes incomprehensible sounds, and withdraws to painful stimulus. A plain CT brain was done and showed. So here we have bilateral subdural hematoma, unilateral left-sided, and here same left-sided hematoma. So what do we see on the CT? This is a brain CT, plain, without contrast. Remember, brain CTs are always without contrast. Okay, so simple plain CT, and then we have the lens crescent shape hypodense lesion, bilateral in the first, and second and third have the chronic subdural hematoma. So what is GCS and what is her GCS? So she is opening her eyes to pain, so it will be 2. You have to explain like this in station. And then she makes incomprehensible sounds, which is also 2. And then she withdraws to painful stimulus. So withdrawal from painful flex to withdrawal from pain is 4. So 4. So 2 plus 2 plus 4 is equal to 8. So her GCS is 4. So Glasgow Coma scale is a neurological scale which aims to give a reliable an objective way of recalling the conscious level or state of a person for initial as well as subsequent assessment. Her GCS is 2 plus 2 plus 4 is equal to 8. What does a loss of gray white matter suggest? So many studies have shown that injury to gray matter, areas of the brain that contains nerve cell bodies, can cause long-lasting cognitive disability. So loss of gray white matter suggests that there is a damage to gray matter, and this can cause long-lasting cognitive deficiency or difficulty. So here again we have the subdural hematoma. Here crescent shape subdural hematoma. Again here this is acute hyperdense. This is again acute hyperdense, and this is again acute hyperdense. And here we have the hyperdense ischemic portion. So management of acute subdural hematoma. Urgent surgical evacuation of hematoma for acute subdural hematoma plus minus coma with neurological deterioration, signs of increased intracranial pressure since time of injury with the potential for recovery. Clot thickness 10 mm or midline shift, so greater than 5 mm on initial CT, regardless of GCS. So if you have a clot thickness of greater than or equal to 10 mm and there is a midline shift, if there is a midline shift of greater than 5 mm, so you go for urgent surgical intervention regardless of GCS. Neurosurgical management patient should be nursed in ICU with ICP monitoring and serial head CT scans. Next scan at 6 to 8 hours. If there are signs of neurological deterioration or persistently increased ICP greater than 20 mm of Hg, urgent surgical evacuation within 2 to 4 hours of deterioration. So in this patient, you will do earlier CT on admission, and then you will do CT on 8 hours because she is also on anticoagulants and greater than 65 years. Plus, she has a dangerous mechanism for fall. Tracheostomy tube advantages. What are the advantages of tracheostomy tubes? So tracheostomy tubes are easier to clean. Also, it's easier to clean the mouth and face, less likely to aspirate, less dead space, rather it decreases the peak stress, better tolerated on long term, more comfort, no gagging, does not need sedation, may help weaning from the ventilator, yes, so may allow swallowing and the ability to eat and drink. So these are the advantages of tracheostomy. So this was quite short, and yes, so here you should remember this chart. I remember this chart by some mnemonics which are very like this is my way. maybe it's not helpful for you, but I will say this is SSP. So spontaneous opening of eyes, so it is 4. To speech, this will be 3, and to pain, this will be 2. So this is how I remember SSP. The next is or verbal. So verbal I remember as OCW, OCW, OCWS, OCWS. And the other, I do this with the motor response as in combination, like OCWS for this, and OL, OLW, FE, OLW, FE. So OCWS, OLW, FE. So oriented, this is oriented in time and person and place, so it will start from 5. So oriented, so it's confused, so 4, and say words, inappropriate words, so this will be 3, and inappropriate incomprehensible sounds, so this will be 2. Here we have the obeys command, so it will be 6. It will start from 6. You have to remember this, that motor from 6, verbal from 5, and the other from 4 starting point. So this is obeying commands is 6. This will localize the pen. L for localize the pen. L for localize the pen will 5, and withdrawal from pen will be 4, and flexion to pen will be 3, and extension to pen will be 2. So OCWS, OLWFE, and the other is SSP. So I have practiced on this mnemonic for even part A, and so that's why I remember this better. So OCWS, OCWS, and OLWFE, OLW, OCW, OCWS, OLWFE. So that's how I remember. Thank you.